Association of Anorexia Nervosa and Associated Disorders says more than 30 million people suffer from an eating disorder in the United States. Health experts say oftentimes eating disorders can go unnoticed, especially in rural areas where problems stem from a lack of resources. MTN Keely's Van Mittendorp has more on an eating disorder clinic in Great Falls that's helping those in our state's rural communities.
Owner of Emily Wish and therapist Crystal Kirschman has worked with eating disorders around the country, specializing in each step to recovery and patient care. She says eating disorders, including anorexia nervosa, bulimia, and binge eating, present similar symptoms in patients no matter where they live.
Whether I'm in Montana, New Mexico, Colorado, wherever I'm at, there's definitely a parallel between them all.
Kirschman never intended to open up her own clinic in Great Falls, but realized the need for Emily Wish after finding a lack of options to treat eating disorders in the area.
And when I moved here, I couldn't find an agency that specialized in it, and so it was kind of to the point where if I wanted to continue doing it, I just had to create it.
Since opening, the clinic has seen an overwhelming response from patients not just from Great Falls, but the surrounding communities.
I have some people from Shelby, Conrad, we've had people from Cut Bank before, so definitely people travel.
From Helena to the High Line, the patients also range in sex and age.
My youngest is 4 and all the way up to about 70.
The clinic also partners with the Great Falls Eating Disorder Task Force in their outpatient services.
Bozeman has an intensive outpatient program, and then we have our outpatient intensive outpatient program here at Emily Wish, and that's the highest level of care you can get for eating disorders in the state of Montana.
Kirschman says it's another resource that helps patients on their journey to recovery.
We range from dietitians, therapists. I know there's been medical doctors in the past. We have a dental hygienist on there, and so just everybody that is really just concerned and want to do the best to help here.
While Kirschman says her future in Great Falls is temporary, she's established a team of therapists who will continue her mission to carry hope for those struggling with eating disorders.
Once I found how great the need was, I started building up. So when I'm gone, this still exists, and the access to care is still here.
In Great Falls, Keely Van Mittendorp, MTN News.
More information about Emily Wish can be found on our websites.